Good afternoon, everyone. Welcome to our October Ask the Experts. We have a very seasonal, I think appropriate conversation that will be happening today. And we have the best in the industry with us to answer all of your questions. So I'm really excited to be here this afternoon. My name is Erin Pellegrin. Many of you may know me through connecting with our nutrition team, or perhaps you've attended our digital education events, but I will be hosting our Ask the Experts this afternoon. And our topic for today is all about answering your insurance questions with Triage Cancer. So many of you may be familiar with this organization. They do such tremendous work. And we know the conversation around insurance and policy and coverage and deadlines is something that can bring us a lot of stress and anxiety. So we are really happy to be here today with, like I said, one of the best in the industry to answer all of your questions. So with that being said, please know that if you have questions as we move through this discussion, you are welcome to put them in the Facebook chat. So we are streaming live on Facebook, so you're welcome to live engage with us. We have your questions from those that submitted to us ahead of time, so we will move through and get to them, hopefully get through as many questions as we can. And for those that may not be able to hop on live with us today, please know that we are recording this segment and it will be available in our HER library. So we know sometimes, again, some of these discussions that have a lot of nuanced terms and information, you're always welcome to come back and do a second listen again. So you'll get that likely as available as soon as tomorrow. So be sure to hop on our HER library. Now, before we bring in our guest for today, I want to just share some events that we have coming up for November, because it's hard to believe that November 1st is next week, but we are jumping off with a Zoom for a couple topics that we have coming to you next week. So as we usually like to start off our digital events, we will be kicking off November 1st with our virtual hangout. And this is what we are calling our Healthy Hair Hangout. So it will be led, I will be there with you, but our beauty advisor, Jolene Hart, will be joined by Tammy Ball from Acure. Many of you know that's a wonderful beauty partner of ours. And we'll be also joined by Carly Assar of Lillian's Lush Organics. And she'll be talking, everyone will be talking a little bit about hair health, scalp health, all types of hair, how cancer treatment affects that, and different products and things that we can do to really support our scalp and our hair health and growth. So be sure that you join us. That's next Wednesday, November 1st, 5 p.m. Eastern time. We will be hosting on Zoom, so you can register for that. And then a really exciting topic, a new one to our Unite for Her community, our speaker series next Thursday, November 2nd at 6 p.m. Eastern time. We are talking about cardio oncology. So we know that heart health is something that can be affected with cancer treatment and something that we want to be mindful of in the long term, our heart health. So we'll be joined by medical oncologist Dr. Bhattacharya from local here in Philadelphia, Jefferson, and also cardio oncologist Dr. Michelle Bloom. And together they will be talking about heart health and some of those treatments that can impact our heart health and what we can do to really preserve long-term heart health in general. So please be sure to join us. Again, that's our speaker series, both events. You'll be able to register if you go to uniteforher.org. If you're not able to hop on with us, as always, our HER library will house both of those recordings. So with that being said, I want to jump right into our topic and introduce our expert for today. So Joanna Doran is a cancer rights attorney, author, speaker, and CEO of Triage Cancer, which is a national nonprofit organization providing free education on practical and legal issues that may impact individuals coping with cancer as well as their caregivers. She has spent more than 25 years working on behalf of individuals with cancer and has presented more than 1,000 educational seminars on employment, insurance, healthcare, and advocacy issues across the country. We are so excited to have her here. Please join me in welcoming our expert, Joanna Doran. Thank you so much for being here.
Thank you for having me. It's my pleasure.
Oh my gosh, this is wonderful. And we know that this is a confusing topic. Like I said, and a little bit like a foreign language when we talk about health insurance, and especially this time of year. So I'm glad we have you as a resource. And I think that this is a good place to start off, Joanna, just in terms of perhaps identifying some key terms for those that are hopping on with us about insurance and what we should know.
So it is like a foreign language, and we often say that health insurance is something that we should be taught in high school because it's something that everybody needs to understand, but we aren't, and we're just sort of expected to know how to navigate our healthcare system and to actually navigate health insurance choices. And unfortunately, I often say that no one in the United States actually understands our healthcare system based on my experience, but now I have data to back it up. 96% of Americans cannot identify or define the 4 key terms that are used in health insurance, and that are also key for us to be able to pick a health insurance plan and understand how it works. And so unfortunately, given the fact that no one really understands those terms, it's not surprising that most people don't know how to actually pick a health insurance plan that's best for them.
Right.
So those terms are deductible, copayment, coinsurance, and out-of-pocket maximum.
Okay.
So I'll give you just a quick overview of what those are, because it'll kind of inform the rest of our conversation, I think. And we want to make sure that people are familiar with those terms. Yeah. Deductible is a fixed dollar amount that you have to pay first before your health insurance even kicks in to start paying for your medical expenses.
Okay.
So you might have a $50 deductible or $500 deductible or a $5,000 deductible, depending on the plan that you have.
Okay.
And then there is coinsurance or cost share. Well, actually, let me explain copayment first, because that's also a fixed dollar amount where you have to pay that amount when you get certain types of care.
Okay.
So you might have a $10 copayment to see a primary care physician, or a $50 copayment to see a specialist. But that's different than coinsurance or cost share, which are 2 terms that actually mean the same thing. It's a percentage. It's the difference between what insurance companies pay for our medical expenses and what we pay for our medical expenses. Okay. So if you have an 80-20 cost share, it means your insurance company is paying for 80% of your medical expenses, and you're responsible for 20%.
Okay.
So those are what we call out-of-pocket expenses. So things that you actually have to pay, even if you have health insurance. So you're still going to pay.
Yeah.
Yes. Or your copayments too. So those are things you have to pay out of pocket. Even if you're paying your monthly premiums for health insurance, you're still going to have those out-of-pocket expenses when you actually get medical care.
Okay.
Your out-of-pocket maximum is the most important thing for anybody to know about their health insurance coverage, because in a worst case scenario, it's the most that you're paying out of pocket for your medical expenses during the year.
Okay.
And your out-of-pocket maximum will depend on your plan. So again, you could have a $1,000 out-of-pocket maximum, or you could have a $15,000 out-of-pocket maximum, depending on your plan.
Okay.
So it's a way for you to actually plan around that worst case scenario. So it doesn't matter, you could have a whole lot of co-payments and a whole lot of co-insurance payments, but they add up to your out-of-pocket maximum. And when you hit your out-of-pocket maximum, then your insurance kicks in at 100% for the rest of the year. So it's this cap on what you actually have to pay out of pocket for your expenses.
Okay.
And, in terms of a budgeting standpoint, no one really wants to pay their out-of-pocket maximum, but at least there's a cap. So you're not paying those co-payments and co-insurance amounts all year long. It's just up until you hit your out-of-pocket maximum.
Okay. And that information should be readily available as people are researching their insurance plans, correct? Yes. So this isn't something that's sort of hidden in the small details.
No, it's a very clear number that should be easily found, and frankly, one of the first things that a plan will tell you about the plan.
Okay. Okay.
So usually they tell you your monthly premium, what you pay each month to have the plan. And then they'll tell you usually your co-insurance amount, like is it an 80-20 plan or a 90-10 plan?
Mhm.
But then they also very clearly tell you what the out-of-pocket maximum is.
Excellent. Okay. So those are some numbers that we should be looking for.
Yes.
Okay. Okay. So good review of terms. And we know that when we're thinking of health insurance plans, it's really important to understand what our options are and what's out there. Why is this so important to us, or especially to our members that may have a cancer diagnosis or do have a cancer diagnosis? Why is that so important to really understand what's available to them?
I think it's pretty common that people only think about the option that's presented to them first in terms of their health insurance options.
Okay.
Like if someone gets health insurance through their employer, they often think, well, I'm going to take what my employer is offering me.
Right.
But if that plan isn't a good plan for you, like it doesn't actually cover the providers that you want to go to, or it doesn't cover your prescription drugs, or it has really high out-of-pocket costs,
Mm-hmm.
then it's not a useful plan for you.
Mm-hmm.
And you might be in a situation where you can actually go to the marketplace, for example, and see what's available to you there. Because if you're paying out of pocket for the providers that are out of network, or your prescription drugs that aren't covered for that plan,
Mm-hmm.
then you might actually be saving money by switching your plan from your employer plan to a marketplace plan.
Mm-hmm.
But you don't know that unless you actually know what your options are and know how to compare them.
And I think that that's actually a really great reminder, because many of us may think, okay, we are just going to stick with maybe what our employer provides to us, but to just take a little bit of extra time, a little bit more due diligence, and just see what else is out there, especially like you said, if we know our particular providers that we have, which maybe we have a long-term relationship, are not part of that employer plan. It's, I think, a good reminder to know that, all right, we may still come back to it, but let's at least do a little more digging to see if we can't find something that might suit us better.
Exactly. And so that's why at Triage Cancer, we really want to explain everybody's health insurance options and what all of them look like, so that you can actually do some comparisons. And ironically, in the United States, we spend hours planning vacations, or, doing research on buying a new car or even a new computer or phone. But on average, Americans spend 15 minutes or less choosing a health insurance plan.
Yeah, I think I'm surprised it's 15 minutes, frankly, because, and that's why it's so useful to have you here, because I think that short amount of time is, a lot of it probably has to do with just being intimidated by insurance and not understanding these terms and what's available. So hopefully this will empower our members to really understand. And we will put that link to your health insurance website so people can do a little bit more reading on their own. But hopefully this will give some good information so that people feel a little bit more confident when they do their own research.
That is definitely our goal. We know that health insurance is not exciting to learn about, or pleasant even to try to figure out this information, but we try really hard to create some useful tools to help people actually understand those terms and know how to pick a health insurance plan. We even have animated videos that kind of break down the basics.
Good, good, good. So we'll pop that link in the chat for those that are watching on Facebook as well. So wonderful. All right. So let's dig into, all right, so I want to choose my own health insurance plan. How do we do that? How can we be assured that we're picking one with the lowest cost, or the cost that fits in our budget?
So it's actually a pretty simple math formula.
Okay.
The hardest part might actually just be going and looking up this information, but it should be easy to find. So the math formula is taking the monthly premium and multiplying it by 12, because that's how much it's going to cost you to have the plan for the year. And then you add that to the out-of-pocket maximum, because that's the most that you're going to pay out of pocket for your medical expenses during the year. And that gives you your total cost for your plan and any medical care that you're receiving. And when we're talking about a cancer diagnosis, most of the time someone is going to hit their out-of-pocket maximum. And that's why we include that full amount in that math formula. But, for someone who is healthy and never goes to the doctor, then maybe you wouldn't be looking at your out-of-pocket maximum. And unfortunately, most people, when they're shopping for insurance, are just looking at the monthly premium because they don't know how out-of-pocket maximums work. So they're not including that in the calculation. But the idea of insurance is actually to protect us in case something happens.
Right.
And even if you're very healthy and you're picking a low-cost monthly premium that might have a high out-of-pocket maximum because you think you're never going to have to pay that, that's not really how life works. And so we know that if someone is diagnosed with a medical condition, the chances are they're going to have to pay more out of pocket. And if you want to protect yourself from those unexpected high out-of-pocket costs, that's how you have to shop for a plan. You have to take that amount into consideration.
I love that. And again, good reminder, because that was the number that I looked at. It was like, take the monthly times 12. Can I afford it? Okay, great. I'm going to assume nothing bad is going to happen. And we really want to, in the event, right? Life happens. And so we just want to make sure, worst case scenario, we're prepared in the long term. And hopefully we don't ever hit that number, or we don't always have to, but good reminder to add in that total at the end.
And I think that that's also important to keep in mind, that even if you have a plan now with a very high out-of-pocket maximum, we get to make changes every year. And so understanding how to review your options and make changes so that moving forward, you don't keep incurring those high out-of-pocket costs is a way to lessen the financial burden of a serious medical condition.
That's a good reminder. And we'll probably touch on some timing in just a little bit, and when that open enrollment is. So we'll get into some timeframes now for those of you that might not be familiar on when your open enrollment might be. So we have the financial aspect of what we want to look for from a budgetary standpoint when we're shopping for health plans. But are there other things that we should also be aware of to really ensure that we're picking the best plan for us?
Well, we briefly mentioned it earlier, but the two other things that are really important about any plan that you're looking at are, does it actually cover the care that you need? So does it cover the providers that you're going to? Does it cover the hospitals that you want to go to? Does it cover the prescription drugs that you're taking? So if you pick a plan that doesn't cover any of those things, you're in a situation where you're going to pay more out of pocket to go to those out-of-network providers, or pay out of pocket for those prescription drugs. So we want to make sure that we're looking at plans to make sure that anything that we think we're going to need related to medical care is covered by that plan. Okay,
perfect. Good things to remember. Okay, network, right, formularies. So let's then jump in a little bit to open enrollment. And I know that some of us may hear the commercials on TV right now that it's open enrollment. I'm not really sure what it's open enrollment for. So what do we need to know about open enrollment in general?
So open enrollment is the time of year where you get to sign up for health insurance coverage or make changes to your plans. Okay. And we used to be in a situation where that wasn't so readily available to us. But with the Affordable Care Act's protections for people with pre-existing conditions, every single year now, we can be making choices about our health insurance coverage, which unfortunately means that it's not a one and done. You don't just pick a plan and then you don't ever have to think about it again. Every year, you should be looking to make sure that there haven't been changes to your plan, that it still covers your providers and your prescription drugs, and to make sure that there isn't a better plan available to you in terms of better coverage and lower costs. So doing that math to make sure that what you have is still the best plan for you. And there's a lot of data that shows that employees who get health insurance coverage through their employer, they pick a plan and then they never make changes to it, even though it's a plan that's not working well for them. But the idea of figuring out a new option is painful. Yeah. So people just stick with what isn't working for them. And unfortunately, again, this is why we spend so much time talking about health insurance, because we want people to have the best coverage for them, because it not only helps them get access to the care that they need, but also can lower those huge financial burdens that can come with a serious medical condition.
Okay. Okay.
But open enrollment, the time frame of open enrollment is different depending on what type of coverage that you have.
Okay.
So if we're talking about an employer plan, that's actually up to the employer. So it's whenever the employer's plan renews. So if they happen to have bought a plan in May, your open enrollment period might be like January to April. So it does depend on the employer, but most employers have calendar year plans.
Mm-hmm.
So the coverage starts January 1st, which means that open enrollment is usually sometime in the fall.
Okay.
Where you actually get to review your choices and make changes. But even if you make changes in the fall, the coverage change isn't actually going to happen until January 1st.
Got it.
And that's also the same for marketplace plans, which are also calendar year plans.
Okay.
So open enrollment for marketplace plans starts November 1st, and then it goes until January 15th. But in some states, it might actually go further than that. But if you want your coverage to actually go into effect January 1st to get that new coverage, you actually have to make decisions by December 15th.
Okay.
So there's a little bit of nuance there, because they need those 2 weeks to actually implement the changes that you want to have happen by January 1st.
Okay. Okay. So we're getting to the start of open enrollment for Health Place. Okay.
Yes. Now, Medicare is probably what you're seeing all the commercials for.
Okay.
Because Medicare's open enrollment actually started October 15th and it goes until December 7th. And
Okay.
that happens every year, where anyone who has Medicare coverage can make changes to how they get their Medicare coverage. But again, it also doesn't start until January 1st. So the changes happen now, but the coverage changes actually go into effect January 1st.
Okay, got it. And we did get a question from one of our members about Medicare. So this person knows they're now eligible for Medicare, but they don't know where to start for that. So how do they get initiated or start that process if they want to look at Medicare?
If someone has questions about Medicare, is to actually call 1-800-Medicare, which I know sounds silly, but it actually is the most straightforward way to get information about Medicare. You can also go to medicare.gov online. But if someone is eligible for Medicare, that only happens in two different ways. Either because someone is turning 65 and is eligible for Social Security retirement benefits, or someone's been receiving Social Security disability insurance for 2 years and then becomes eligible for Medicare. I'm guessing that that individual might have gotten some information about their eligibility. And in that case, I would follow whatever steps they were given. But if they have questions about any of that, again, starting with Medicare is the best place to go.
Good. And I'm glad they make it easy, 1-800-Medicare. So at least, that part is easy, getting in touch with them. Okay, so back to open enrollment, generally speaking, what happens if a person loses their health insurance at a time that is outside of that open enrollment window? Do they have to wait until the open enrollment time for a January start, or how does a person handle that situation?
So in those cases, there are special enrollment periods. If someone loses their health insurance coverage through work, for example, they actually have a number of different choices for health insurance coverage at that point. They could go look to see what plan options are available to them in the marketplace, and they would have a 60-day window to go and buy a plan in the marketplace from when they lose their employer plan. And then they could also consider COBRA, which is the federal law that allows you to keep your employer coverage for an additional period of time. You also have 60 days to choose COBRA from when you lose coverage. So they made that a little bit simple for us, and that those timeframes are the same. But maybe that individual might qualify for Medicare or Medicaid even. Or maybe they have access to another group health insurance plan. Like if a spouse has a plan through their employer, could they move to the spouse's plan? Or if it's someone who's under the age of 26, could they move to a parent's plan? So there are a number of different options, and we actually have a quick guide to losing employer-sponsored coverage that lays out the options and helps someone understand how to compare them so that they have the best coverage for them.
That's really great that you called out that resource, because we did also get a question from one of our members about this very thing. You know, maintaining a full-time job for the sake of insurance is something that can become overwhelming and maybe just unattainable for someone with a cancer diagnosis. And so having a place that a person can go to really understand their options, so that if they decide to leave, they know, how they can maintain health insurance or how they can help pick that up, so that hopefully there's not too much of a downtime between being covered. So I'm glad that you have that resource available for our members. That's great.
We have a lot of resources to make sure that people don't lose access to health insurance coverage. But we also have our legal and financial navigation program, where if people are confused about transitions in health insurance coverage and how do they make choices, we can provide information about their specific situation.
Okay. And is that website the triagecancer.org/get help? Is that the link? Perfect. So we'll put that in the navigation program. Good. I appreciate a link that makes it clear and easy to remember. So get help is easy enough for us to remember. So we will also put that chat or that link in the chat for those, but that's wonderful. Okay. So now we have insurance. Let's assume now we have health insurance and we've got coverage. Are there certain nuances about our plan that we should be mindful of, that any patient should just be mindful of when they're pursuing doctor's appointments or medications or tests? What should we be aware of?
We always say that the two biggest contributors to financial toxicity are having adequate health insurance coverage and then knowing how to use it. And so just getting adequate health insurance is only step one. You do have to know how to effectively use your policy. So things like making sure that you're going to in-network providers so that it's actually covered by your plan, and that you're not going to out-of-network providers that won't be covered by your plan. But there are a lot of hurdles that insurance companies make us jump through to actually get coverage for our care. And one of those is prior authorizations, where insurance companies have a specific list of types of care that they want you to get their permission first before you actually get that care. And so before you're getting the care, you have to get authorization from them that they'll cover it. The two incredibly frustrating things about this process are, one, they don't give you a list of all the things you need to get prior authorization for. So you kind of have to figure it out or ask them before you get care. And two, it's not a guarantee of coverage. It's just a prior authorization. So even if they give you prior authorization to have surgery, for example, they could still come back later and say, we're not going to cover that surgery.
So, okay. So you just put clearly into context, and I know I will say I am definitely guilty of this, sort of glazing over that this is not a guarantee of coverage. So that's really upsetting.
It doesn't make it easy on us as patients.
Yeah.
However, the flip side of that is, healthcare teams are your best advocates in the conversation around prior authorizations, because they're often the ones who are getting that for you. But it is still your responsibility at the end of the day to make sure that you're getting prior authorizations for any care that you're getting. The second thing is, there is an appeals process. So if an insurance company denies the prior authorization or denies coverage for the care, you don't have to take no for an answer. You can appeal that decision.
Okay.
And that is often what I call the best kept secret of our healthcare system, because 99.9% of denials are not appealed. which
Wow.
is concerning.
Wow. Okay. And
And
if someone wanted to appeal, is that information readily available to them? How does a person find out where to begin with that process?
well, there are two good sources. One, on any denial, there is supposed to be information on how to actually appeal.
Okay.
And two, at Triage Cancer, we have a lot of resources to help people navigate the appeals process, because this is a soapbox issue for us because no one actually knows about the appeals process. And the truth is that if people aren't getting coverage for their care, two things are happening. One, they're not getting that care because they can't afford to pay for it out of pocket, or they're paying for it out of pocket, which means that lack of knowledge of the appeals process is contributing to barriers to access to care and contributing to financial toxicity because patients are paying out of pocket for care that their insurance company may have had to pay for.
And is there any way for a patient in between, they've received the prior authorization, but then before maybe they have that test to really find out, okay, will this be paid for? Or is that sort of a elusive, we'll just get the test or have done whatever my physician ordered and then kind of a wait and see thing? Is there anything a person could do ahead of time or no?
The most important thing to do ahead of time is to get the prior authorization if that's required by the insurance company.
Right.
Other than that, making sure that you're going to in-network providers and that the care is actually covered by the plan. Those are all good steps. It's just not a guarantee. It's not that every time an insurance company is coming back and saying we're not covering, but if they do, it's important to know that it's not unheard of and that you do actually have rights and that it's worth actually pursuing those rights, because on average, about 50% of the time, patients are actually successful when they go through the appeals process. But there's actually two stages of the appeals process when we're talking about private insurance.
Okay.
Private insurance, like through an employer or through the marketplace, has an extra level of protection for patients where they can appeal inside the insurance company. And if the insurance company still says no, they get to go outside the insurance company through an external appeal to an independent entity who looks to see, is this care being prescribed by the healthcare team medically necessary for the patient? And if it is, that decision is binding on the insurance company and the insurance company has to cover it.
Wow. That's great to know.
Yes. And I will tell you, because I spend so much time speaking in the community, this is something that patients don't know about, but it's also something that providers don't know about. So it's why I call it the best kept secret of our healthcare system, because no one knows that this protection exists, even though it's been in effect for about 13 years now.
Oh, nice. Oh, that's really good to know. And is in terms of Medicare and appeals, is that just a single step? Is that sort of its own? I mean, I would imagine it's its own process in and of itself.
It is, and it does have multiple levels of appeal, but external appeals is only exists in the context of private insurance. But with Medicare or Medicaid or military coverage, there are specific appeals processes, and we do lay those out on our website as well.
Perfect. And that was going to be my next question. So to sort of help to make sure if a person is going through that appeal process, that they get everything that they need, you have resources on your website for that. Yeah. Okay. So great comment from Facebook. We're seeing it feels like health insurance plays fast and loose with standard of care for cancer patients. Yeah.
I would say that health insurance is a business, and that across types of medical conditions, insurance is looking at trying not to pay for care that they don't need to. And so they put into place these different processes or hurdles that are all called utilization management processes, where they're trying to manage individuals' usage of health insurance coverage, like getting prior authorizations or step therapy or, outright denials of coverage.
Mhm.
And so it's important to keep in mind that the industry or business of health insurance is not charitable, which means that as patients, we have to be on our game to make sure that we're getting the coverage for the care that we need, and to be working with our healthcare teams and enforcing our rights to make sure that we're getting access to that care.
So well put. And I know that Triage Cancer offers a wealth of resources, but before we hop into that, there is one quick thing I just wanted to go over that came in from some of our members with Unite for Her about a cancer policy in particular. So for those that may be unaware, can you explain a little bit about what a cancer policy is? And is this something that may be an add-on to their health insurance? Is it difficult to sort of navigate or move through a particular claim? How does that work?
Cancer policies are actually not health insurance coverage. So they're separate insurance policies that people can buy, sometimes through an employer, or sometimes you can buy directly from an insurance company, where it covers care related to a diagnosis. So sometimes there are cancer policies, sometimes there are policies for chronic conditions or like accidents, for example. And if you have a cancer policy and are diagnosed with cancer, it covers certain things. So if you have to have surgery, it might pay you a $10,000 check to cover out-of-pocket costs, or it might cover things like travel and lodging to get to treatment. Or if you have a cancer policy and you haven't been diagnosed, it might reimburse you every time you go and get a cancer screening. So it's really around cash benefits as opposed to coverage of healthcare, like a health insurance policy would provide, but it's as a result of being diagnosed with cancer.
Got it.
So you submit a claim, including your medical records that you've been diagnosed, and then in the claim form, you specify sort of which benefits you're eligible for based on the expenses that you've had. And then they send you a check for that money.
Got it. Okay. So this is something that they could use to supplement their primary health insurance and additional policy with that. And is that something that you hear submitting claims or, receiving payment for people that have these policies? Is that something that's difficult to go through, or timely, or lengthy, or a pretty straightforward sort of process?
For most of the companies that I have had experience with, it's pretty straightforward. They have a claim form that is available online or paper, and it's simple form that you fill out based on your policy information and providing the supplemental documentation that shows why you're eligible for benefits, and you submit that, and then they send you the check. So it's unusual to hear of challenges with actually receiving checks because it is a pretty straightforward process.
Okay. So I guess the best would be if someone was having a little bit of difficulty, just, reach out to their insurance policy, try to get connected and keep things moving along.
Yeah. So if someone is having challenges, like they haven't received their check, contacting the company would definitely be the first step. But if they're feeling like that's not useful, or it isn't, getting a response, they can also contact their state Department of Insurance. So the insurance agency in your state is who regulates companies that offer these policies. And on our state resources page, we actually have the contact information for all of the state insurance departments.
Perfect. And I think that this is a great segue into just wrapping up and sharing a little bit more about what members can find at the triagecancer.org website. So I know we've talked about appeals, we've got state contact information, help with picking insurance plans, but what else can a person expect to find through your organization?
At Triage Cancer, we provide education on all of the legal and practical issues that come up. So that could be insurance, but maybe it's employment or disability benefits, or even estate planning and medical decision-making documents. And you can find all sorts of resources, everything from those animated videos I mentioned to worksheets to actually do the math to compare your plan options, to recorded webinars that kind of do a deeper dive into these topics. So you can find all of that on our website at triagecancer.org. And then we also provide educational events that you can attend live to learn more about these topics.
I love that. I love that. I think you are just really empowering all of us to make the best decisions for ourselves and giving us the information in a way that is understandable, tangible. I love a worksheet. So being able to have a little bit of guided activity to help me along to make sure I'm doing it right. Math was never my strong suit. I think all that's so helpful. So we are so appreciative of it. And we got another comment that came through that I think also is just a good reminder for us. Don't be afraid to call your insurance when you get an EOB stating they're not going to pay. Give them a call.
Absolutely. And then to also check in with your provider, because maybe it was just about the wrong billing code that was used by the provider, and that's why the insurance company won't pay. It's not uncommon to see mistakes on medical billing and on EOBs.
Yeah. So hopefully, if that is the case, they can make a swift resubmission with the new code, and then everything will be fixed. So it doesn't always have to be, sometimes we jump to the end and we think it's going to be the most difficult process, but just communicating and reaching out is a great place to start.
Exactly.
Wonderful. Oh, Joanna, you're the best.
Well, thank you so much for talking today. We really appreciate sharing the availability of these resources and to also spread the word about the importance of understanding your health insurance options.
Absolutely. And like I said, we will be adding all of those links into the chat. We'll also make sure that they're available in the recording of this segment in our Her library. So for those that may come back to rewatch it, or for those that you might be sharing this video with, they'll know where they can find all of this great information as well. So with that being said, don't forget that November 1st deadline to start. It's coming up soon. I can't believe it. But again, Joanna, thank you so much for your time. And we appreciate all of the hard work that you do for the cancer community.
Thank you so much.
All right. So with that being said, this wraps our Ask the Experts for today. Really great information. I continuously learn when we talk about especially topics like this. Just as a quick reminder, we've got November starting next week. So we've got our virtual hangout, our healthy hair hangout next Wednesday, 5 p.m. Eastern time. And then we're talking cardio oncology on Thursday, 6 p.m. Eastern time. So hopefully you will join us for those. I also want to make sure I give a big thanks to our education sponsors. So today's Ask the Experts is presented by West Pharmaceutical with additional support from Daiichi Sankyo, Lilly, Merck, and GSK. We are so grateful for their support to bring you really important topics every month, just like our Ask the Experts today. So with that being said, I hope everyone has a wonderful weekend. Stay safe and healthy, and hopefully we will see you again soon.